How to help someone experiencing claustrophobia. Have you ever felt trapped in a small space? For many, this feeling can be overwhelming and lead to a condition known as claustrophobia, which is a fear of enclosed spaces. If you want to help someone dealing with this fear, cognitive therapy, especially cognitive behavioral therapy, offers a structured approach that can make a real difference. First, it is important to identify what specific situations trigger their anxiety. This could be anything from elevators to crowded rooms or even airplanes. Once these triggers are recognized, they can be organized into a list from the least to the most anxiety-provoking. This ranking helps in understanding where to start. Next, addressing the negative thoughts associated with these situations is crucial. Through a process called cognitive restructuring, the person learns to identify and challenge their irrational fears. They can replace these thoughts with more balanced and realistic ones. This shift in thinking can help reduce the emotional weight of the feared situations. After working on thoughts, the next step is gradual exposure to the feared environments. Start with the least distressing scenarios. This exposure can happen in real life or through imagination. The goal is to help the person build confidence and reduce their tendency to avoid these situations. By facing their fears repeatedly without escaping, they learn that the outcomes they dread are unlikely to occur, which helps lessen their anxiety over time. During this process, it is also helpful to teach coping strategies. Techniques such as relaxation exercises and controlled breathing can assist in managing anxiety symptoms when they arise. Working with a trained therapist can ensure that the exposure is paced correctly and that cognitive techniques are applied effectively. Helping someone with claustrophobia involves several key steps. Start by identifying and ranking the situations that trigger their anxiety. Then, challenge and change any negative thought patterns they may have about enclosed spaces. Gradually expose them to these feared situations to build tolerance and teach them coping skills to manage anxiety during exposure. This approach typically requires multiple therapy sessions and has been shown to significantly reduce symptoms of claustrophobia. By following these steps, individuals can regain their ability to function in everyday life and reduce avoidance behaviors.